My name's Trevor Prior. I'm a consultant podiatric surgeon based in London, working in both the National Health Service and private practice. One of my areas of speciality is treating sports injuries, and I've worked with a wide range of sports including football, rugby, hockey, cricket, athletics, tennis, golf, to name a few. I've worked with both amateur and all the way to professional and international sports people. One of the great challenges of managing this type of patient is dealing with their footwear. In a number of sports such as football, rugby, athletics, the shoes that they wear are much tighter or narrower. And in some sports such as football, the players like to wear the boots 1 to 2 sizes too small so they can feel the ball. This provides unique challenges to the clinician. In particular, once we've decided someone's appropriate for orthoses and we know what type of control they want, actually fitting the orthotic into the shoe so that it's comfortable is the great challenge. As a result, I formed a company called P2L, which looked at performance sports footwear. Our aim was to design a boot that not only fitted the player perfectly, but the stud plate, the sole of the boot, was also the orthotic. So rather than this just being flat, it was contoured. Clearly, this is the optimum for any professional sports person, but the cost and time involved is too much for the amateur. There's therefore a great need at the other end of the market, or for rapid intervention, to provide something that's quick, cost effective, functions well and fits well within the boot. That's why we came up with the concept of providing a performance device specifically designed for cleats, football boots, etc. Using this information and experience, as well as the experience of Vasyli, we've been able to design the first device specifically for this type of footwear. This contains a number of features which we'd like to explain today, and has been tested on professional footballers both for function and durability. The first of these features is a heel lift. Many football boots and spikes etc. are flat, which accentuates any problems with calf inflexibility or equinus. By incorporating a small heel lift, this helps to offset that and improve function. Also at the heel, we have a 3-degree medial wedge to physically support the foot. This helps to improve the control but keep the bulk to a minimum. When we look at the mid-tarsal area, we have a lower profile than normal, which is good for people with lower profile feet, but it also helps with fit. In addition, the peak of that profile has been brought slightly more proximally, nearer to the talar-navicular joint or sustentaculum tali, so that we can get slightly more control for less bulk. At the front of the orthotic is a small metatarsal dome, which helps to support the central metatarsal heads. Poor load beneath these heads is a common feature in boots, and this helps to improve the spread, as well as facilitating first ray plantar flexion, which in turn facilitates first MTPJ dorsiflexion and improved function. So the main bulk of the orthotic, the red part of the orthotic, is 80 Shaw EVA. It's slightly extended further forward underneath the metatarsal heads to help facilitate first ray plantar flexion. This is heat moldable, and using the traditional marking technique, this can be molded within the shoe to help better fit the contour of the foot. There's 50 Shaw PU or polyurethane for shock absorbency, and that is extended all the way over the top of the orthotic. Although the orthotic includes a degree of control, obviously this can be modified. If we wish to increase the control on the medial side at the rear foot, we can take a standard medial rear foot addition and apply that to the orthotic so that we've increased the support. If need be, in some instances we need increased lateral control. Bearing in mind there's a 3-degree wedge, by applying a 3-degree wedge on the lateral aspect, that would negate but provide a better heel lift, and increasing that control would provide lateral rear foot control if appropriate. Similarly, we can do some forefoot adaptations. In this particular instance, I've applied a 4-foot medial post so that it goes from the 2nd to 5th metatarsals. This helps to facilitate first ray plantar flexion, and if you had a problem, say, with sesamoiditis, you could apply some more cushioning. In addition to that, you could do lateral 4-foot posting if that was appropriate for the patient. Many conditions require a multifactorial treatment plan, of which orthoses are one component. If we look at conditions within the foot, such as sesamoiditis, lesser MTPJ overload, neuroma, plantar fasciitis or cuboid compression syndrome, there are features within the orthotic that can help all of these conditions. At the rear foot, Achilles tendinopathy or calcaneal apophysitis in the juvenile, sometimes termed Sever's disease, will all benefit from control, in particular the heel lift incorporated within the device. Proximal problems such as medial tibial stress syndrome, patellofemoral dysfunction or reduced stability will all benefit from the control provided. The secret of any treatment with orthoses is to optimise the support dependent upon the activity and the limitations of the footwear. For the first time, this is an orthotic that is specifically designed for the unique confines of football boots, spikes, etc., allowing you to provide a quick, cost-effective and efficient device to help manage your patients.